Keogh, for joining us for this interview. I would like to start with my first question. Can you maybe explain a bit to the viewer what is the general aim of your research?
Yes, well, my research is very much in the area of the psychology of pain, so I'm very much interested in how people think, feel and behave and how that has an effect on pain and how people respond to it.
Okay, great. And which part of your research do you consider having to have the biggest impact on the field?
I think the main area that I think I'm most proud of is certainly the work that I've been doing on sex and gender differences in pain. So this is very much looking at whether or not men and women differ in pain and how it's expressed, for example, and also the effects that sex and gender might have on treatment.
And did you notice any obstacles or barriers when performing that research?
I wouldn't say barriers as such. I think certainly, I think there is a difficulty in trying to persuade people that sex and gender differences are important. But I think the message has definitely got out there, and I think we're looking forward to seeing how that works out in the future.
Okay, and when you got the message out there, how did the community the research community react to that?
I think positively. I think it's not just me who's working in this area. I think it is generally accepted that there are sex and gender differences. I think coming back to the question about barriers, I think is then what do you actually do about it? How do you actually investigate this? And it can be quite difficult. You need to have additional people in your studies, for example, and there can be a financial barrier. But I think it's an important one that we need to consider and actually sort of design studies which bring in sex and gender into the investigation.
Okay. And then in your plenary lecture that you gave here today, this week at the Congress, you talked about the influence of gender on pain, which most people would expect that gender also influences pain, but also that pain might influence gender. Can you explain a bit more on that?
Yeah, this is very much drawing on some of the research that is within the field of gender and gender research. And here, when we look at the way in which, as you say, the research that actually is there, it shows that one's gender identity can have an impact on pain. But actually, does seem to happen the other way around. So actually what can happen is pain can actually have an effect on identity. An example of this, there's certainly some studies which have looked at, for example, the way in which pain can affect people's roles and what they actually do. So you have a very strong, for example, traditional masculine identity where you're going out and working. If pain prevents you from doing that, it can have an effect on your gender identity as well.
Okay. But then for other researchers, what do you actually exactly recommend that they take into account for gender and sex in their future studies?
Certainly, I think the first step forward is certainly to try and incorporate an investigation of differences between men and women, for example, in studies. So rather than statistically control for the differences, I think researchers should be investigating this in the first place.
Okay. And your own research, do you have any idea for the next steps now, or what are your future research ideas regarding sex and gender?
Oh, most certainly. I think I really would like to investigate a lot more this idea of gender and gender identity and how that has an impact on pain. And also, I'm very interested in the way in which pain is an expression, so how we communicate pain to one another. So, the way in which, for example, my facial expressions or body posture or vocalizations, these are important cues which we use to communicate pain to others. And so if we think about it in a sex and gender context, what that actually means is we can start thinking about, for example, gendered interactions. How do I interact with a male and a female, and do I differ in terms of the way in which I communicate that? And equally, do those people who are observing me differ in terms of how they pick up on those sorts of cues, depending upon the sex and gender of the person who's broadcasting these cues?
Yeah. And then considering your area of expertise, do you have any advice for other young researchers out there?
Oh yes, certainly. I think the key thing is to attend meetings like this, congresses, conferences, and talk to people. I think one of the things that's really struck me about the pain community is how friendly it is, and it doesn't matter what level you're at. Actually, we're very keen to talk about ideas, talk about researchers. So I think the biggest thing I can suggest, or the hopefully most helpful thing I can suggest, is talk.
Okay, great. Thank you very much for joining us, and we'll look forward to more of your research in the future.
Oh, thank you very much for asking me.